It's my understanding that he does not support Medicare for all. But let's see if I'm wrong about that one at least. Yang, Medicare for all. Okay, too disruptive. So, crystal ball. Take your time. That's cute. I'm not fishing for things, but the reason why I said Medicare for all was I was pretty sure, like, if I hear a candidate say I don't think Medicare for all will work, blah blah blah, that kind of bullshit, I'm like, nah, get the fuck out of here. All right, we got, we could save like a couple $1 trillion doing Medicare for all. Okay, we don't need to be making money off sick people. Okay, it's a system that clearly doesn't work. Freedom dividend will not deliver without the freedom to have good health care.
I did hear your pushbacks on social media, so I wanted to explain a little bit more why I think this positioning is a mistake and ultimately inconsistent with Andrew's overall worldview. So first of all, if you really believe that automation is causing and will continue to cause massive job loss, disrupting the job market in a fourth industrial revolution, few things are more critical to addressing that problem than making sure that every
and while this is loading here, just to be clear, I despise Crystal Ball. It's mainstream media garbage. So let's all make sure we take this with a grain of salt.
No matter what they do.
So she didn't really say anything, did she? I mean, this is a bunch of bullshit. Okay, so this was in October of this year. Literally a couple days ago. In the new comments, Andrew Yang has clarified his position on Medicare for all. And look, I'm looking at this source that you gave me, and I have some questions for you, man. Okay? But so he says he agrees with the spirit of Bernie's Medicare for all plan, but calls getting rid of private insurance over a short period of time a bit too disruptive. I would not do it. So he was cornered. It sounds like he was cornered on the question of would you abolish the health insurance companies, which Bernie and I believe Warren in the last debate or a debate before said yes. No, Warren didn't. Maybe it was one other candidate that said, yeah, we should get rid of health insurance companies. Yes, get rid of them. Let them go out of business. I mean, because well, here's the thing, not like make it a law that, health insurance companies need to be illegalized. No one's supporting that. But basically, no one's going to prop them up if they go out of business because they can't compete with the extremely low costs of Medicare for all. If they want to offer in European countries that have Medicare for all, in whatever form that they do, if private insurers want to offer Cadillac services, they can absolutely do that, and people will perfectly be able to do that, no problem. Let's see here. Okay, yeah, this was the fucking thing that she just fucking repeated. But here's the thing, man. So, all right, access to quality health care is one of the most important factors, yada yada, overall well-being in America's one of the few, blah blah blah, yep, and private healthcare systems leaves million insured, yep, bankruptcy, yep. Same time, cost care is higher, and also, private more, okay, Affordable Care Act was a step in the right direction, fair enough, yep, providing funds, states, yep, expanding Medicare, however, didn't address fundamental issues of the system. Access to medicine isn't guaranteed to all citizens. The incentives for healthcare providers don't align with providing quality, efficient care. The incentives of healthcare providers don't align. Yes, that's true. Yep. It's because there's a profit motive. It's a race to the bottom. This must change. The Medicare for all system. Okay, what does that mean? What does this mean? Okay, what is your definition of Medicare for all? And I'd like to contrast that when we go over here, because it starts off with policies, right? On Bernie's side over here, right? Right at the top. Policy, create a Medicare for all single payer national health insurance program to provide everyone in America, blah blah blah. Okay, that's a policy. Pow. No networks, no premiums, no deductibles, no copays, no surprise bills. And I'm not seeing an explanation of what the fuck that means in this screed here. Let me keep going though. By increasing access to preventative care, by increasing access, that's a neoliberal fucking buzzword. Increasing access, that just means giving you access to more private insurance companies. To preventative care will also bring overall healthcare costs down. With a shift to Medicare for All system, costs also can be controlled directly by setting prices provided for medical services. The best approach is highlighted for the top-ranked Cleveland Clinic. Their doctors are paid a flat salary instead of a price for service model. The shift has led to a hospital where, so this is his Medicare for All model, a private for-profit model. You know, where the instead of a for service model, they shift over to this Cleveland Clinic model, where doctors are treated like, I guess what, shift workers, flat salary. Your doctors, really a salary worker. The physician turnover is much lower than at comparable hospitals. Well, that's interesting. I'd like to see those numbers. Doctors also report being more involved with their patients since they're salaried. No need to churn through patient after patient, so they spend their proper amount of time. All right, fair enough. Okay, but this sounds like money. Sounds like you have to roll up with some dough. Outside of a shift for Medicare, obviously we look at the South American Foundation for, okay, it's a treatment center for native Alaskans, both symptoms, obesity, blah blah blah, free or here. This is just another example of I guess how by providing holistic health care to all our citizens, well, what the hell? Will drastically increase the average quality of life, extend life expectancy, and treat issues that often go untreated. Okay. I mean, I don't disagree actually with this because, I'm the nihilist, right? I understand that society has, I put in my Twitter, I am what you've made me. Because their society is devolving into pure negative nihilism, right? We're starting to become so cynical that we can't accept anything as a truth, which is okay as long as we can find a truth that is actually somewhat legitimate, which we're not doing. But anyway. I'm not seeing policies here, right? When I go over to Bernie's, here we go. Medicare coverage will be expanded and improved to include dental, hearing, vision, home and community. Where's this? What is Medicare for All? What does it cover? How does that work? Well, here. Inpatient, outpatient services, mental health, substance abuse treatments, reproductive and maternity care, prescription drugs, and more. All right, he wrote the damn bill. Okay, he wrote the damn bill, all right? Stop the pharmaceutical industry from ripping off American people, exactly. More details. Okay, and here we got some story time. Okay, more policy, baby. Allow patients, pharmacists, and wholesalers to buy low-cost prescription drugs. Cut prescription drug prices. Policies, baby, policies. I want them policies. I want them goddamn policies. Okay, when I go to this link, what do I get? I get a bunch of hooba juba about this hospital's doing something cool. This hospital's doing something pretty neat. He identified the problem correctly. I'm not seeing solutions, dog. All right. So yeah, I'm pretty sure he's not for the Medicare for All as defined by Bernie, who's been defining it for like the last 40 years. So I'm pretty sure that's why I pointed that out. But if, right off, that's from the horse's mouth right there. That's from the man's website. Here's the goal that are on his mobile website that I copied and pasted. Lamau. Holistic healthcare for all Americans. Bend the cost curve of healthcare down. Focus on preventative and holistic care. Change the incentive structure for doctors. Allow doctors and hospitals to innovate in treatment. Ooh, boy. That's not the answer to the problem. I wouldn't disagree with being like, we got to understand, that sometimes people are sad because society is hard. And maybe we shouldn't pill people up and that kind of thing. I'm not going to disagree with that. Let me just turn this off. Sorry. I'm not going to disagree with that, right? But come on now, it sounds a little iffy. Okay, to be frank. All right. But you know, I'm the kind of guy though. Like when I actually would have liked. We should have had Marianne Williamson back up there, or Marianne Williams. Is that how you say it? But you know, her talking about, you know, we need to start like loving each other again. You know, this is coming from a nihilist. Okay. We got to start thinking about, you know, why people are so sad and why people are so negative and why people are so, you know, down, and why do negative things, you know, exceed where positive things get, you know, put in the dirt. So, you know, I don't completely disagree with this idea of like holistic, you know, kind of like paying attention to your spirit and, you know, how you feel about that. But is that the solution to the multi-trillion-dollar fucking healthcare industry that is fucking bankrolling politicians and steamrolling our laws and killing motherfuckers yearly? By overcharging people for pills that, you know, you go across a fucking imaginary line drawn in the sand, and all of a sudden a $600 pill turns into a $5 pill. Outrageous. They play with our lives like fucking puppets. Okay? These insurance companies, these pharmaceutical companies, and these politicians that enable them. They need to be cut the fuck out. Okay? And if you're a politician up on the stage and you're not talking some real shit about the healthcare industry and about how they're destroying people's lives, then I'm not taking you as seriously as I would, right? $1,000 a month, that's a great idea, all right? That doesn't give you an excuse to be a jackass about healthcare. All right, get your shit together, Yang. Let's talk next election, okay? You know, change your mind on a few key policies, okay, Yang? And then we'll talk, baby. We'll talk.